Hello. 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 Check sound. 1, 2, 3. Audio. Perfect. Hi, Laxman.
Exam is for everyone.
Laxman, audible? Laxman. Hello. Hello. इसमें हेलो लक्ष्मण
Last year, it was. telehealth. And you all must be aware that WCPT, that is World Confederation of Physical Therapies, this year theme is on COVID-19, role of physiotherapy, its crucial role in COVID-19. Apart from that, due to social distancing and spread, telehealth is a concept which is emerging out for people with chronic illnesses to communicate with their doctors, physicians, or to have consultation with them. Is which you could able to stay in touch with your healthcare and get your problems sorted and so on. So it's an appropriate theme-based event, and I'm very glad and thankful to Dr. Laxman Kuchhadiya for kindly immediately agreeing to our request to deliver a talk. All the people who are on this forum, we have physiotherapy students of all the batches, we have residents from physiotherapy colleges, and we have a lot of clinician practitioners, academicians who are all lining up in this activity. And just to brief, yesterday we had a good e-poster presentation by our physiotherapy residents on the theme, and we gave them away certificate as token of appreciation for the best poster. And today is 2 webinars we have planned. One is by our alumni, our own KMPAP alumni, Dr. Laxman. Right now it is going to be there. And in the evening, we have yet another talk on biomechanical analysis, deformity and management by principal of a deemed university, Institute of Physiotherapy and Rehabilitation, Ambala, Haryana. And tomorrow we have all the undergraduate programs, students, poetry recitation, posters, graphical representation on COVID. So we are having that competition tomorrow. And day after, the most important activity, we are going into the community level through online. Many of our students, residents have created short videos where they could able to target and help in treating those people with chronic illness in the rural areas, like conditions like stroke, Parkinson's, cerebral palsy, intellectual disability. All these conditions are going to be addressed. The first point of person is the VHWs, that is the village health workers. And we will be to them, and they will be spreading the knowledge to those particular patients who are suffering from such problems like cancer difficulty, sitting difficulty, standing difficulty, walking problems like that. So these are the activities lined up by KMPAP for this World Physiotherapy Day. And I congratulate all of you who have been contributing for this profession. On behalf of the whole fraternity, myself as a principal, wish each one of you a very happy World Physiotherapy Day. Let's all continue doing our good work for the community upliftment. And without taking much time now, I hand over the stage to Dr. Laxman to start his presentation and give his good insight, his own experiences about how to conduct a telehealth, what is a telehealth, and what are all the conditions that we could able to address through the telehealth and ethical issues involved, and of course, the benefit of telehealth. Thank you so much to each one of you who are connected with us virtually. And thank you, Dr. Laxman, again for being with us. Over to you. Thank you so much. Now the stage is yours. Thank you.
Thank you. So, good afternoon to everyone. Thanks to giving me this opportunity. I will share my screen. So, Can everyone see my screen? Like a response. So how do I?
Yes.
Yeah. Okay. Good stuff. So let me go first. So yeah, today we'll go to I will share my experience on telehealth or how to do an online consultation or events in physiotherapy. So a little brief about myself. So myself, Laxman Kuchhadiya, I'm working as a senior occupational health physiotherapist in the UK. Since this COVID-19 pandemic, we are doing telehealth or online consultation. Before this, we used for like a 5 or 10% only, but since this COVID-19, we are using like a 95% in online consultation only. This presentation is mainly like I'm briefing towards a musculoskeletal condition. So if I'm biased towards musculoskeletal, sorry about that, but yeah, that's my experience, and I'm working in that field. So yeah, my presentation is towards the musculoskeletal only. Yeah. So what is telehealth? I guess everyone know about that. What is telehealth? So I will say go into it. So there is electronic communication to share medical information from one place to another, or from one person to another person. Some people use telehealth, some people use telemedicine, but they have a little difference in that. So telehealth is mainly for preventive or promotive or yeah. But due to COVID-19, and we had to maintain social distancing, and if people are self-isolating, this telehealth is become a key technology for safe and effective communications. So what are the benefits of telehealth physiotherapy? So there are a number of benefits, but there are like few main benefit that we are using it is like we can rapidly, or we can access to the patient quickly, and we can advise and reassure to the patient in an early stage, and give them an initially like give them a self-management at the start. So that helps to prevent the chronicity of the condition, or mainly the musculoskeletal condition, and it helps the patient to take ownership of the condition. So with the telehealth, we can provide them exercises, or we can provide them a strengthening program, and that is a key for any sort of musculoskeletal injuries. Yeah. Another thing what you can do is we can screen the patients, yeah, so for the urgent or possibly worrying symptoms, and it's like red flags, and we can signpost to the appropriate field as in early stage. So that helps to prevent any further damage. Yeah. We can help employees, because I'm working as a occupational health, so we are directly dealing with the employer and employees. So yeah, we can help employees for their fitness at work, so we can guide to the employers whether employees are fit to work or not, and what we can do to maintain the fitness. And it's a really important in this strength time, because if employee is not fit to work, then it breaks the chain, and they can't provide, especially the frontline workers. So if they are not fit physically, then it will break the chain. So if we maintain that fitness, then everything goes smoothly. Yeah. And by doing this telehealth, it's like a standard practice. We can share our experience, like the treatment session is going to be a shared one between the physiotherapist and the patient. So it's similar to the face-to-face things here. So the important part of this is ethical and professional issues. We need to address these if anyone wants to start the telehealth conversation. Yeah. So first thing is the scope of the practice. So we know that telehealth or online consultation is alternative of face-to-face consultation, but still it's worth to check with your professional bodies or the governance body whether it's appropriate for your practice or not. Yeah. The second thing is patient consent. So it's always mandatory to take patient's consent, even in your standard practice. But with the telehealth, you need to go in a bit more depth. Like, what is telehealth? Why are you doing this telehealth? What are the strengths and weakness of telehealth, and how it works if they are not aware of. So it depends upon the patient whether how knowledgeable they are about the telecommunication and all this stuff. So you need to vary around that. Yeah. Another thing is privacy. So again, it's similar to our standard practice. We have to maintain the privacy of patients that we normally do in our appointments. So that is like if we have to record or if we have to take images, we have to take permission, and it's a mandatory. Yeah. So it's similar to the standard practice. Yeah. So nothing new. The drawback of this is equitable use of the technology. So because the people have variable knowledge on technology and like understanding or because of that disability or something, they may not have that much knowledge on technology. So it may cause a problem. So you need to think before you start your telehealth appointments. Yeah. So whether they are appropriate, whether your community is appropriate for the telehealth or not. So sorry for a bit of a crowded slide, but yeah, it's a really important one. So the technology security is one of the kind of like flaggy area in the telehealth, because if we are using a device that is shared with the other person as well, and then we need to make sure that the account is under control, and you need to use discrete accounts and make sure you use a strong password that if another person is not aware of it. You need to make sure that internet connection or Wi-Fi is reliable and it's secure. So you should not use a shared one where that can get your data easily. Yeah. If you are sending your report to the other person, make sure you are using encrypted file. So like if you are sending your email to the patient or to the trust if you are working for, then make sure you use it encrypted. And make sure that all of whatever information you are getting through the video call or telephone conversation, transfer it to the appropriate health and care record. So wherever you normally record, and then take it off from your device. Yeah. Make sure you're not storing any confidential patient's data on your device. If it is absolutely necessary, try and use a secure folder, yeah, and kind of like a password protected folder. You need to make sure that you are following the general data protection guidelines, depending upon which one is available. Yeah, and if you need to go through it, you go through the data protection guideline as well. Yeah, and delete any information. So if you are taking any data, and if you are recording any images, delete it once you have your task. Make sure you are deleting the number of your device as well, and just from the as well. So delete everything from the backup data as well. Yeah. If you are sharing with the people, so as I said, with the patient or the trust, or whoever you are working. So I'm working with employers directly. We have to send our reports to the employers. So for that, we need to make sure that we are sending it encrypted. Yeah, it's no problem. So that is a possibility. Right, and another thing is regulation. So in India, this is not something that we need to worry about, but here we need to have an insurance to practice, because if someone comes on you, then it will protect ourselves. So if you are starting your telehealth, you can check it, whether that is protected or not. Because sometimes, I guess in USA, if you are working from home, your insurance doesn't protect it. There are other considerations that we need to take into place while doing telehealth is mainly because of the cultural variation. So we need to consider eye contact, whether it's appropriate or not. Checking, make sure if you are recording an image, ask or take permission from the patient. Consider whether the patient require same gender or specific gender for their appointment. And I think it's the same to the standard of a face-to-face clinic as well. We always ask these things, and we always take into account of these issues. Yeah. And another thing is considering whether or not a translator is required. So if they are not using same language, you need to go for the translator. But in a telehealth, the translator can be a bit easier because we don't know the background. If it is a face-to-face, we can take the detail, but with the online, there is a possibility that market and the data protection. Yeah. So make sure if you are using translators, be very, very careful for that. So far, I haven't used any translator in my practice yet, so I have no idea how it goes, but yeah, I guess it should be okay. So what are the things that we will need for the telehealth? So as everyone knows, we need a computer, laptop or tablet, mobile device with a functioning microphone and camera, and strong and reliable internet connection for the smooth communication, and any sort of app if you are using during your practice, kind of like exercise app or education app. So we are using a Physi app, or it's called a Physitrack. I will go through with that at the end of this end of this presentation, like how we use it. So like anyone can subscribe that app and they can send it to the patient. So it's very easy to use, but it's really, really good for the patient. And even in our standard practice, in my face-to-face clinic, we always use that app. So it's nothing new for us, but yeah. So there are a few things that you need to take into account before you place a telephone or a video call to the patient. So first thing is make sure you are in a well-light area and your room is quiet and it's private. Yeah. Make sure that your patient is aware of the tele or online consultations. Yeah. Also, you need to make sure that you have access to the patient's clinical record, so you should be aware of them. Medical history of these as normally you would do for your face-to-face. Make sure on the day the technology is working, so check whatever app you are using. So whether if you're using Google Meet or anything, make sure it is working, and yeah, your device is working properly as well. If you are doing telephone consultation, make sure you use no caller ID. So that means, yeah, so they don't get your number and they don't start ringing you back when they record or when they think they need to talk to you. So that's for your privacy. Yeah. What I normally do is for any sort of consultation, I first do a telephone consultation. So with the telephone consultation, we normally go through the verbal consent and all this stuff, and explain the purpose of the appointment, all this stuff, and then we take a detailed subjective history through the telephone consultation. And if we are not sure if you are not sure about something, then I go for the video consultation. But 80% of the time, I have done telephone consultation only. Yeah. So video consultation only 20% in my day-to-day practice. So when you start your consultation, whether it is phone consultation or the video consultation, initiate the consultation by calling or inviting the patient. So say like Mr. Patel or something, invite them, and start the conversation saying like, or from the patient to say like, can you hear me? Or if you're doing video call, can you hear me? Sort of things. So then they will start. Make sure you take and record a verbal consent form or verbal informed consent. So if you're doing your video consultation, then you can share your screen with the patient and say, look, we are doing this. What is the purpose of it? Where we need to share. So this is my consent form that we normally use in our day-to-day practice. So and just to go through with each point in a detail, and then like put the date and record it appropriately. Again, make sure you are saving in the secure folder, so no one can use that because there is confidential data about the patient's name and date of birth. Other thing is introduce yourself and introduce everyone in the room, or if you are sharing your call with someone else, introduce themselves as well and ask the patient to do the same. Here, what we need to do is sometimes our managers hear us or assess us in the background. So still, patient is not aware of it, whether is anyone available or not, but still it's for the confidentiality we need to introduce to them. So like whether someone is shadowing me, something like that. As we know, telephone consultation is hard mainly for the patient. So reassure the patient that it is confidential and it is secure and it's similar to as a standard face-to-face appointment. So when you do a video consultation, so during your consultation, make sure you inform the patient if you are occupied. So whenever you are typing or when you are putting your data, make sure inform the patient that I'm typing, so bear with me. Make a written record as you would normally do. It is harder for the patient, so you may need to be in a more detail and it may be less fluent compared to face-to-face. So sometimes you need to explain a bit more. So make sure you keep that time during your appointment as well. While you're closing your consultation, ask or first to summarize key points with the patient and ask patient to summarize what they got from it and say like how they are going to summarize key points to their friends and family. So just ask how they're going to do that. Ask the patient if they need any clarification because of technical interface. There is a possibility that we get something different or we miss something. So ask to the patient to clarify things so that everything is correct and everything is okay for them. Make sure confirm with the patient whether they are happy to continue with telephone or video consultation in the future. If they say no, then provide them self-management program and signpost appropriately. And end the telephones with saying goodbye and speak to you soon, something like that. So what the skill you will require to do a successful telehealth assessment? So it's hard, as I said, it's hard for the patients, but it's really hard for the physios to start with. And so for most of the physios, physios struggle to do is multitasking because you have to ask patient and then you have to listen to the patient. You have to respond to them as well, along with your typing or your recording appropriately, and then you are thinking of the second question or other questions as well. Yeah. You need to be really thorough with your subjective assessment. So you need to get your 80% of your diagnosis through the subjective assessment. So make sure you ask even an objective question in your subjective assessment. So you can, if you are assessing someone's shoulder, then you can ask how far can you lift your hand? What can you lift? Can you get something from your from top sides? Or if you are assessing that backhand, so like how far can you bend? How far can you bend backwards? And like can you get out? Can you get from the chair without support? Or can you use stairs? Something like that. Yeah. So depending upon the basic condition, ask objective questions because that is one of the weakness of the telehealth, that we can't do objective assessment. We can't do hands-on. Yeah. So with a video call, you can ask the patient to show their movement and show them where they get pain, or pattern of the pain, and or pattern of the mechanical dysfunction, all the stuff as well. Yeah. The other thing is discussing outcomes. With a face-to-face, yeah, we normally do that, but in telehealth, maybe a bit more important, and you may need to go a bit more detail. So you need to ask patient what's their goal, what they want to achieve through the physio, and then share your outcomes, so like what you are expecting from the physio, from the treatment. Yeah, so it needs to be shared discussion. It's aware that any of the musculoskeletal condition, we always provide them a self-management, and it's one of the key things for the physio, MSK physio, and it's a key for the musculoskeletal condition. So with the telehealth, we can provide self-management very well. Yeah, so it's similar to the standard face-to-face. Here, we normally don't use any electrical, or we don't prescribe any like a TENS or IFT or anything. It's more of the exercise based, so either kind of like a stretching strengthening program or functional training. So it's easy through the telehealth. So it doesn't make any difference to us in from the face-to-face to the telehealth. So with the self-management, we can provide them like a diagnosis, what these mean for them. So explain them in the layman term, and because if they are aware of the condition, they can take that ownership of the condition. Yeah, we can advise on modification of the duties or problems, like how long it can take. We can reassure to the patient. You can provide the information booklet and condition specific access. So information booklet is really important to know for the patient, because if they are aware of the condition, if they know the timeline of the condition, how long it takes, then it helps in their rehabilitation. So what are the conditions that we can treat through the telehealth, or what are the best for the self-management? So clinically, if someone has OA, so OA of neck, shoulder, back, hips, knee, anything that any of the OA joint, we can provide them a self-management. We can very well handle through the telehealth. Any sort of soft tissue injuries, kind of like a tendon ligament injuries, yeah, we can provide them a self-management program, and it's successful most of the time. Yeah, and as I said, any condition that requires exercise as the most appropriate form of the treatment. So I guess almost all of the musculoskeletal condition we can treat with the exercises and education or modification of the duties. For the successful self-management, patients should have a good understanding of the condition. Their mental health should be in a good stage. They should be coping well, and it should not be causing any issues in their home life or in their dependence. Otherwise, they won't be able to manage it very well, or they won't be able to do self-management at home, and that can cause, that can impact on the prognosis as well. So there are the few things that we can't do through the self-management, or we may need to refer for the further assessment. So those are the red flags. So if someone present with a red flag, signpost them to appropriately depending upon the symptoms and history of peripheral joints. So acute injury, and if they are not improving, and if you are suspecting something like muscle injury, like a muscle tear or something, and if they are not improving, or any fracture, refer to the appropriate field. Or if you are not clear of the diagnosis. So if you don't know what's going on with that patient, whether it's because of the neck, whether it's because of the shoulder, or whether it's before the pain, then don't give them self-management and refer to the appropriate. So either to the A&E or to the GP. If someone have hearing or communication issues, that is, like as I said earlier, if they are not using same language, so language barrier, or if they are hearing, if they have hearing issues, then you may not able to assist through the telephone or telehealth consultation. Psychosocial issues, again, if it is causing a significant impact on their quality of life or functions, poor understanding or unable to take any information, poor mental health, especially in these strong mental health we need to consider. And if they are not in the good mental health case, and if you think like someone have orange flags, you refer to the appropriate field. And if it is impacting on the responsibility at home, so whether self-management causing problem in their care, or responsibility of their children, then don't provide them self-management, and refer for appropriate. So I hope that makes a little sense, like how to do and what are the things you need to consider. I will share one of my live patient, like one of my real patient with you guys. So a few weeks ago, I had a patient with the right shoulder pain. The referral was from the employer. As I said, I work as an occupational health physiotherapist, so we normally have our clinic on site, and we treat their employees. So if, like suppose, if it's a warehouse or if it's a factory, so we normally treat their employee if they have any musculoskeletal injuries or any musculoskeletal dysfunctions. So had a referral through the employers, and the referral included was like, patient is off from the work since 12 weeks because of the shoulder. He had a GP appointment, and they had prescribed painkillers, and had a ultrasound as well, and it's diagnosed with a rotator cuff tendinopathy. Had an exercise leaflet from GP, and like he was doing those exercises regularly, but it wasn't impacting him. So and the patient's occupation was a warehouseman. So production line. It's a physical job, really manual job, repetitive movement. They have to lift to use like a manual truck and all the stuff inside the warehouse to do that job. So it's kind of like a really physical job. So they need their shoulder in a good condition. So we went through the subjective assessment, and I find it like something is because it was causing a lot of issues in the quality of life. He couldn't do any self-care, or he couldn't do any day-to-day activities at home as well. So we did it first telephone, and then we went through the video call consultation. I saw that he had hardly 10% of his shoulder movement because of the pain, he couldn't move. He was holding his arm. So I prescribed them some exercises. Yeah, so set up exercise program that we go in the next slide. Yeah. So prescribe some exercise and ask him to contact GP for like a bit more stronger painkillers, because we know the diagnosis is tendicular, so sometimes it takes time to recover. And I started with loading exercises, but after 2 weeks when I reviewed him, there was no change of it. So, and he was off from the work since last 14 or 12 to 14 weeks. So I sent a letter to GP. So I sent a letter to the patient for the GP whether they can give him a steroid injection. So patient took that letter with the GP, and GP agreed to give an injection. Most of the time they can give injection straight away. So most of the GP are trying to do a steroid injection. So he provided to the patient. It helped. So again, he rested for 2 weeks. Had a follow-up appointment with me again. Reported significant improvement. Sent it, and the patient was happy to return to work. So we provided a phase return plan to the employer, and he returned to work. So again, it's really important to provide that plan to the patient and to the employer in our day-to-day practice, in my day-to-day practice. Whether they can do their full duties at the start or whether they need modification of duties. So through the telephone, so we normally use email to transfer that or share with employers, and we did the similar things, and the outcome was great. And discharge him after about 3 weeks time. So that's all. I will just go through with the exercise app that we normally use in our day-to-day practice. So I don't know how to serve it. So try and serve. So I don't know whether you come across with these or not. Have you seen online or not? But so this is a physic track that we normally use in our practice, even in a like a standard face-to-face practice we normally use for the self-management. As you can see, there are 5,257 exercises. You can change it. So if you just want for something like just for the theremin, you get exercise only for theremin. So the exercise, you can create your template as well for the common conditions. So the conditions, so if I have my name, so you can see there are a few exercises that, or a few of the template I have created for myself. So you can just click those, add into the basket, and you can create a patient's account, and then you can save it there. So you can. Another important thing with this is education. So you can provide them an education leaflet. So there are plenty of education leaflet you can create from your side as well, from yourself. So all sorts of education leaflets, and you can use those outcome measures as well. Just taking time, sorry. So basic health questions, start back tool, so all sort of tools that you can use it online only. So you can share with the patient, and they can fill it and you can see. So you can create it. So it's like is it the client that you can show these things. So you can add clients, and it's very easy. You need their name, last name, year of birth, and their email address. That's it. then you can send that link to the patient and they can open the, another thing with exercises, I forgot to mention it. So if you go to the exercises, it's included with videos and instruction as well. You can set how many reps you you like to do, how many time in a day, and how many seconds you hold it. And if you want to put any additional comment for that particular exercise, you can use that as well. Yeah, but I guess in India it's not available yet, but you can still subscribe that. And it's really important. It's one of the key things for us to do, key things for us to prescribe self-assessment to the patient. Yeah. So we can do everything from these. You can track patient record, whether they are doing or not. You can, they can put a feedback on that as well. They get feedback of that particular exercises, and you can comment on it. So yeah, still, it's kind of like you can track a record, and you can guide the patient even if they don't have an appointment with you. Okay, so we stop sharing. Any question from anyone?
Thank you, Laxman. Dr. here. I think that's the interesting part of this area. Probably, I think it's an eye-opener for many. And before I give my concluding remarks, I request any of the faculty students have any questions on the deliberations what Dr. Laxman has made. The forum is open for a minute or so to, if you have any queries to ask. I think the presentation which you have made is very lucid. You have given some pictorial representation also, and the case study, your experience, rather, that throws more light into the topic, which really help all the people who are connected over here. And as I told in the beginning, this is the new normal. I think everybody is gradually getting adjusted to this scenario. And I think people have adopted it, embraced it in a better way. And it's a long way to go. New arena opened for budding physiotherapists also to take up this as a career opportunity. So thank you, Laxman, for giving your adequate time in sharing your knowledge and giving your expertise in this area. And I feel very happy and glad as a principal of the institute. I get connected to the students who have passed out even before I joined this institute. Thank you so much. We need to strengthen the alumni, and your presence really add value to the World Physiotherapy Day celebration. Look forward to have you with us in the future activities too. Do visit the campus next time whenever you happen to visit India. We can have in-person discussions also. We can think of some collaborative activities. Now that we have become a university by ourselves, you must be knowing you got your certificate from Sardar Patel University. Now we are a university by ourselves, by Kakka University. So we have lots of freedom to explore more and go for a lot of tie-ups and memorandum of understanding to do better to the community, for the students and to the patients. So
that's great.
Thank you. So on behalf of all the faculty and students of KPIP, I extend my heartfelt warm wishes on this auspicious occasion, and my best wishes and blessings to you to grow higher and higher in this profession.
Thank you
so much. Thank you.
Thank you.
Nice to see you, and hope to meet you soon.
Yeah, definitely. Yes. Bye bye.